Hi everyone. This is a narrated PowerPoint for your oral pathology section of the course. I hope having it narrated will help you with the terminology. Looking at the learning objectives, I'm going to let you look at those on your own. We'll not take up our time to discuss those. So let's look at the introduction. If we think about oral pathology, we'll notice that many systemic diseases as well as infectious diseases are actually sometimes diagnosed by the dentist. The dentist will notice abnormal pathologies in the mouth and they will refer them on to a physician, and ends up they may have a systemic disease such as diabetes and it has gone undiagnosed. So the dental assistant should understand the terms to be used in the pathologic conditions in order to record them correctly and to actually have a professional vocabulary. So we're going to look at some of that terminology. So what exactly is oral pathology? It's simply the study of diseases in the oral cavity. Only a dentist can do the diagnosis or a physician, but we are definitely two extra eyes for the dentist so that we can see things and ask about those things and to find out if they're normal or abnormal. Anytime you see something in the mouth and it is something you have never seen before, you always need to point that out to your dentist in a private way, either maybe out in the hallway in their office. Ask them about it before that patient leaves the office and let them take a quick look at it. So let's review normal. WNL, that means within normal limits. You can have normal variance in lesions. So what that means is you may have 2 or 3 different things that look different, but yet they are normal. So one of the main things is pigmentation in the tissue, and we'll look at those in just a minute. You can have different sizes, variations. You can have different shapes and age of the lesion, but yet it might still be normal. So looking at a normal primary dentition, as you see here, you have normal primary teeth, you have lighter attached gingiva, and you also have the unattached gingiva here that'll always be a little redder or a little pinker. You also have a labial frenum here. You have the mandibular labial frenums. These are muscles. Again, another normal primary. Now this is different than the one we just looked at, but yet the pigmentation is there, but it is still normal. The only difference you see in these two images is that you see a darker color here that's coloring the teeth, which means that this person has a darker pigment in their skin, so this will be a darker skinned person. Sometimes this shows up in the oral cavity, not always, but it's very typical, very common, but it does not make it abnormal. It is still normal. So that's a variance. Here you have a normal mixed dentition. You have permanent teeth trying to erupt. You have primary teeth that this person's losing. So if you look closely, you will see permanent teeth that are trying to erupt. The tissue sometimes will look red, a little bit irritated. That's just simply because the teeth are coming in and some of them are trying to exit the mouth, and it just makes it different. The tissue look a little different. This is a normal permanent dentition. You notice how nice and collared the tissue is. Nice around the neck of the tooth. It is pink, no red, no inflammation, no irritation. Looks like this person has good home care. Very normal. Again, this is very normal. This is an adult with a normal pigmented gingiva. You see the darkness around the gingiva. Does not make it abnormal. Still very normal. Again, you have a normal permanent dentition. You have attached gingiva, unattached gingiva. Of course, we see the teeth. We see the labial frenums, the muscles. All of this is very normal. Here we have the maxillary labial mucosa. You can see a variance in the coloration in this one. You see a pink and then a real dark red. That's just simply the blood supply of the tissue. Nothing abnormal about that. Mandibular, we have the same thing. So attached and unattached gingiva will have variance in color. Then you have just a normal gingiva here. This is pink. It is stippled, which means it kind of looks like the orange peeling. If you will see all the little areas here in the tissue, when the tissue's dry. If you look at this tissue, look how nice and shiny and stippled it is. And then around the collar of the teeth, you see no plaque. The gingiva looks nice and healthy. Good home care. Again, normal gingiva just has pigmentation. Okay, let's look at the tongue quickly. We've talked about the tongue in class before. This is a normal tongue, and what they're trying to point out is the papilla on the tongue. You have the circumvallate, you have the fungiform, and the filiform. This is very normal. A normal tongue. Different colors. You can see the little filiform, little papilla on it. Okay, this is normal. This is the circumvallate papilla back here that we were looking at earlier. This is the uvula. This is coming down from the maxillary. This tongue could probably be brushed a little bit better. If you see the white coating, that means that there's usually bacteria there that needs to be brushed off. This is another image of the filiform. The one here, the large ones back here are the circumvallate. You can see they sort of go in a V shape. Very normal. Another normal of the tongue would be the floor of the mouth and the lingual frenum. You have the frenum that attaches to the tongue, and then it attaches to the lingual of the tissue on 24 and 25. So that is normal in that length. The ventral of the tongue. If you look at the tongue here, you see the frenum that attaches. You're going to see different colorations on the ventral of the tongue. You see the blue. Those are veins of where the blood supply is. You're going to even see some little yellow looking. And then you have the reds and the pinks. This is the apex, which is the tip of the tongue. Okay. Anytime you see the word glossia, that means that it's referring to the tongue. So here we have ankyloglossia. Ankyloglossia is often called tongue tie, which means it is a short lingual frenum that extends from the apex of the tongue. So let me show you what that looks like. We have a lingual frenum ankyloglossia here. If you look at the apex of the tongue, and then this is the lingual of 24 and 25. So you see how short that is compared to the long one we looked at earlier. This is ankyloglossus in an adult. You notice the length here. This is going to cause the person a problem when they try to lift their tongue. Trying to lift the tongue up, that's as far up as the tongue will go. You see the little lingual frenum there. Again, ankyloglossia. Can't stick the tongue out. Okay. So in ankyloglossia, we have a loss of lingual range of motion. Range of motion is abbreviated ROM. This can cause problems with a person trying to use phonetics, meaning they cannot, their phonics, they have trouble pronouncing words. They have trouble eating. They have trouble sticking out their tongue. So this can damage this lingual attachment on the lingual of 24 and 25. Let me go back to that. So if you notice how this is pulling against this tissue here, it can cause the tissue on 24 and 25 to actually pull away from the teeth. So that can be a problem. Okay, so how do they correct that problem? They correct it with something called a lingual frenectomy. If you notice in the first image, they are holding the tongue up and back. On the second one, they are actually clipping it and shaving it a little bit. And then on the third one here, you will see where they have sutured it. So they basically have released it, sort of like a rubber band. That's called a lingual frenectomy. This is a lingual frenectomy post-op. So now you see how far the person can stick the tongue out will help them in eating. It will help them in their phonics and their pronunciation of words. Okay, so let's look at the maxillary frenum, this area here. It should be this high. It basically attaches the lip to the attached gingiva. And again, we have it here, but we also have it in a primary dentition. Now, this could be normal, but it's causing an issue with the teeth. So here we see the maxillary frenum in this area, but you notice we have the diastema here between the primary teeth. The frenum is coming here and actually crossing over and going into the lingual. That will keep those primary teeth, that will keep that diastema there. It will not close against that muscle. So there's something called a labial frenectomy. You reposition that attachment and it allows the diastema to close. Typically, you have to have orthodontics to close the diastema once the person gets permanent teeth. Okay, I'm going to stop there and we'll pick up in another recording. We'll pick up with talking about the palate.